Jo Grabyn has a Bachelor of Health Science, Nutritional Medicine, and has studied, see if I can get this right, it's been a tongue twister for early in the morning, psychoneuroimmunology and psychoneuroendocrinology. So it's basically how your thinking creates and changes brain chemistry, affects hormones, the immune system, and the whole body in turn. So most recently, she's qualified in the Bredesen Protocol, also known as the MEND Protocol, making her one of the few in Australia who can use this method to tackle, reverse, or prevent, which we love, the onset of early Alzheimer's and dementias. Just recently, she's trained with the Institute of Functional Medicine, studying neurodegeneration on a deep level, and the Integrative Medicine for Mental Health over in America. She operates from her clinic Bounce Matters in Manly, Sydney. Jo, welcome.
Thanks, Mason. Hey, how you going?
Yeah, super awesome. Thanks for jumping on. How is it down in Manly today?
Warm, sunny, and the sky is blue.
Magic, yeah. I think it's like starting to kind of like peer out. Sun's peering out in Byron as well. So we're on. So let's jump into health and brain health. Like we've kind of haven't had a chance to go deep and have a chat, despite the fact that we've had the intention to for some time. We've been connected through Superfeast, and I'd gone and checked out what you were doing, and just I could just tell from looking at your website, like it was like years ago, I think, when we first connected, just how much I would have loved having a conversation with you, and it's like awesome here to jump on. Do you want to just say a quick hello to everybody? Introduce yourself. Anything that I might have missed?
I think you pretty much covered it, mate. I'm really excited to be here because my passion for a long time has been looking at how we can facilitate mind-body medicine for brain and mental health, which obviously includes gut as well. And it's because I actually have my own history through both sides of it. I've got, my grandpa died of Alzheimer's when I was 11, so I lived it. I'm just very passionate about looking at everything that we do. And we know that these processes, particularly on the brain health side of things, start 20 or 30 years in advance. Now, my theory is if you can prevent something, isn't that a heck of a lot better than actually trying to, turn it around once you get there? Because, it's a much harder journey once someone's actually fully established or diagnosed with a neurodegenerative disease. And there's just so much in life now that comes to that. And I'm really passionate about working with kids that have got mental health problems right through to, people who have been watching or helping their families or their parents deal with neurodegenerative disease and go, hey, this doesn't have to be you. This is not your destiny, kind of thing. Yeah,
it's really nice to see it turning a corner because it was I believe for a long time, like, and I don't know whether I'm just in a bubble here or, you're on the ground there, like whether it is becoming more accepted, that these are preventable. I feel like that's becoming even more of a mainstream narrative now, but again, I might just be in my little Byron bubble up here. What do you feel?
Look, I mean, I'm a little bit in that same bubble as you, as far as, the world I live in, people are talking about it, but often I do have doctors who are referring patients to me because the doctors just do not know what to do. They're just not taught anything about prevention. And they're often seeing medications aren't working for people. They're having women particularly, we know that Alzheimer's in particular is, it's about 67% of Alzheimer's, people that are diagnosed are actually female. And so it's looking at, it's a stigma. Women don't want to even talk to their friends about the fact that they can't remember their words and they can't finish a sentence and, oh, God, what was I just talking about? And, if they go to their GP just goes, oh, you're really stressed or you've had a divorce or you're a single mum or, you work full time, and they come up with all of these, excuses because they don't understand that actually there is something going on underneath. Yes, stress is definitely a part of it and it's a driver, but there's so much more to the picture. And when they negate people by saying, oh, it's just stress, then people think they're whinging about nothing and it's all in their head. And, in a sense, it is in your head, but it's actually right through your entire body, and it just happens to be that that's how it's presenting for you. So I think it is much more accepted and people are feeling that it's safer to talk about it now.
Well, I think like one of the things that's like kind of like behind the grey matter curtain is like what's actually going on, because I've had that as a kid, like just been told that I was stressed and was tried to put on medication because of that stress. It's so weird because it's such an ambiguous like concept to be going for when modern medicine is so nuts and bolts. So like let's get into a little bit of like you mentioned there that the brain and obviously the body are connected. So when there's going to be something going on in the brain, there's something going on down in the body, and the brain is the body, of course. Not trying to create that separation. But when we're talking about neurodegeneration, can you, whether you want to start in the body or the brain itself, just let us know some of the things that are happening, like what it is, that's actually going on. Like you mentioned there, if you're losing a few words or, not remembering so well, what's actually like rubber hitting the road, like going on in the body?
Yeah. Okay. So it's a lot, and it can be different for lots of different people. So, and I think, one of the ways to address this is looking at the fact that, we used to talk about Alzheimer's, and now we actually talk about Alzheimer's due to what, so we're looking at, potentially at least 6 or a combination of 6 different drivers for dementia and, mild cognitive and onto moderate cognitive decline. And that's, so you're looking at things like toxins, you're looking at things like, high sugar levels. Some people will have heard that Alzheimer's is also called diabetes type 3. And you don't have to be a diagnosed type 2 diabetic to convert to a type 3. If you're insulin resistant, then your blood sugar levels can already be high enough to be causing inflammation and causing damage in your brain. It can be hormonal. So it can be, particularly women, we used to just think about the fact that estrogen dropped off when, you go through menopause. And now we see so much hormonal imbalance in, teenagers, women in their 20s and 30s. And, and that's when they're starting to get the memory issues. And estrogen is very closely linked to brain function. Then you've got our toxic environment that we live in, fluoride in the water. Yeah, awesome. Thanks so much for that, government, because fluoride is a neurotoxin.
How does that actually, just out of my curiosity, how have you found, like, in your work, because you've been going deep and studying with experts all around the world, and you just got back from America last year or this year?
Both.
Both, okay.
And the year before, actually, one, yeah.
Just very briefly, how is fluoride? Because there's, I know it's kind of hitting the mainstream a little bit more. It's been like extreme, like, conspiracy theorist, and now it's kind of getting like, okay, there's actual data on it being a neurotoxin. How does that actually interact in the brain?
As far as the chemistry, I suppose I personally look more at where have people got toxic load.
Yes.
So it's inflammatory, anything that creates inflammation, whether that be in your brain or in your gut, because of the vagus nerve, you've got, the minute you've got, or the millisecond really, that you've got inflammation in one, you've got it in the other. So down to a chemical level to explain that to you, I'm probably not technical enough.
But is it inflammation that it's causing? Is that
yes.
on that? Okay, so that's the.
It's inflammation, and it can actually lodge in the brain. So a little bit like mercury, these metals and these toxins have very, very long half-lives, which mean that when they come into the system and they cross the blood-brain barrier, they stay there for years. Like mercury's 20 years or more before your body can even think about starting to detoxify it. And what I'm seeing that's really interesting is when I do have patients who are coming in with mild to moderate cognitive decline, or even, they have already had, they might come to me with saying, I've got chemo brain because I had chemotherapy, and then we dig deeper and find out actually they have a rare form of Alzheimer's because of, whether it be their job that they had. So I've got a lady who was a lead light artist, but then she came to me with chemo brain in her, that's what she thought she had, because 5 years ago she did go through chemotherapy. And then when we did her heavy metal, she had high fluoride, she had high lead, she has lots of filling, so she had high mercury, and then she had high platinum, which was complements of her chemotherapy. So, it doesn't really matter what metal or what toxin we're talking about.
Right.
Once they're there, they're really hard to get out, and they do damage while they're there. And it depends on the person as to how that's going to play out.
And these various forms, I know there's 6, but I'm sure that's even generalizing in terms of how many types of Alzheimer's and neurodegeneration there are.
That still doesn't cover all of it, but that's how we try to categorize it to keep it a little bit simple.
Yeah, which is nice. And and that's an awesome, I appreciate it, because we've got to simplify it in some sense. Otherwise it's not graspable. What we're trying to is empower people to get on the prevention bandwagon, and also, get into their sovereign health a little bit so they can understand what's going on without understanding the whole science of this whole neuroscience. I just wanted to ask, is that kind of something that's becoming more well known now? Where can people find out more about these 6 types, or is that something that you use in your clinic?
Look, it's part of Dale Bredesen's work, and he did actually publish his first book in August last year called The End of Alzheimer's.
Okay.
So Dale digs into it more. He was the one who first broke it down. And, just a little bit of clarity on Dale. Dale, for 25 years, was a standard neurologist who was absolutely hell-bent on finding the silver bullet for Alzheimer's. And his wife is also a doctor, and he goes, don't you hate it when for 25 years your wife's telling you something, and she kept telling me it was metabolic and lifestyle, and eventually I had to concede and say yes. And that was when we started digging into it. So
far out. Was he looking at genetics mostly?
They were looking at genetics. They were looking at vascularity. They were really digging into the beta amyloid plaques, the tau plaques. There's so many different things. And
getting close.
You've just got to look at the massive failure rate of every drug that they've ever trialed against Alzheimer's. Like very occasionally they'll make it to stage 3, which is what they've got to get through to get something listed. And then, it's literally like a graveyard of drug failures. Like, it's really horrific. And, Dale's been in this space for a long time, and he really wanted it to be the silver bullet. And just the more he dug, the more he realised how complex this condition is. And, dementia in general, because dementia is really your umbrella. It just happens to be that Alzheimer's as a group is the most prevalent.
Yeah,
so we'll probably talk about it more.
Okay, great. You mentioned the gut-brain connection. That's been like its real like snappy thing that, I know that a lot of Instagram health influencers love like whipping that one out at the moment. And but I like you started making that connection between the vagus nerve. I just wanted to quickly touch on that to really, because I like, just for my own sake, it's always for me nice to get a little bit of like, all right, what's actually going on? Where's that connection actually lie? And also that appreciation for inflammation here, inflammation there, because quite often I know growing up, there was no connection between the brain and the body, and just thinking like, and I know like a lot of people are like, that's okay. I've got my brain, I've got my mind, and I don't really, they'll let the body go a little bit. But I was like, where's that, is there any truth in that at all? Or is it like just full connection? Full connection.
There's no, it's interesting because I have some patients who feel that they're very well versed in medicine and in general health. And even when I started talking brain health with them, they're just like, Jo, I can't believe I never actually joined the dots. And it's like, well, it's actually physically connected. And, when we're conceived, when, that little ovum initially starts divides into 4, and one of those 4 cells then becomes your brain and your gut.
Mm-hmm.
So you get the connection. And it never disconnects. Like, we do have issues around vagal tone and things that can create more problems with that, but and that's something for a different conversation. But what we know is that we're understanding so much more about the microbiome, and we used to think that basically the brain was a clean space, that it didn't actually have any bacteria in it. Now that we know we're only 10% human, that kind of blows that entire theory out the door. So if there is anything going on in the gut, if your immune system is responding in any way, if you have, dysbiosis, so, a whole bunch of bugs that shouldn't be there and not enough of your good bugs that need to be doing a whole lot of the work, then there is a problem going on in your brain. So we know that, if you have a food like gluten, for example, we know now, according to research, will inflame 100% of human digestive tracts at some level. The millisecond that happens, there's something, there's an immediate sort of equal response in your brain. And you've got to think about the fact that 70 to 80% or more of our brain chemistry, like dopamine and serotonin and etc., are made in our gut. So when the drugs were actually designed to target your brain, it's like, no wonder they don't work for very many people, because you're targeting the wrong place. So gut health really is at the crux of everything.
Yeah, like me and Tani always think about the fact that, like, it just that reductionism of modern medicine, which can be like that compartmentalizing can be useful, and as well, especially when it's integrated, which is just possibly not integrated at the moment. But at the same, like, you can see it when they're going at a cadaver and they're breaking up a body, that it's just a scalpel straight through the fascia and all the tissue to go, now that's that part. Whereas there's actually, without the scalpel, there's no differentiation. You can't tell through the tissue when one organ or muscle or fascial connection starts and stops. There's no start and stop. There is that connection, and that unification needs to be acknowledged. And so you're obviously working on that level, which is amazing. So here we've got a lot of people listening to this, possibly with people who have got neurodegeneration in their lives or themselves. And also a lot of people here getting on the front foot and ensuring that they fortify their body and their brain tissue. Give themselves the best opportunity. Yeah. That's what we want, right? Like, and so we're aging just with like, not even just gracefully, well, and with grace, with dignity, but just like being like on fire, like not literally like not inflammation, but just like, just with rock and neural health. So
yeah.
With all of that in mind, I want to have a look at like when someone comes into your clinic, and you begin that process with them. Where do you take them?
Okay, so I always say to someone before they come in for their first session, because my first session with someone, it's long, and so we go broad and we go deep. And I'm like, if you imagine your entire life from the time that your mum was pregnant with you until today, think about it as a jigsaw puzzle, and you're going to walk into my office, you're going to take the lid off and you're going to dump that upside down on my desk. Because we're going right back to your family history. We're looking at what things were like for your mum when she was pregnant with you, possibly even life prior to conception. We're going to be looking at sort of genetic, what does the medical family tree look like? And so it's not just going to be going, oh, you've got someone with Alzheimer's or you've got someone with dementia, so maybe that's a thing for you. It could be you've got someone with cancer in your family or an autoimmune disease. So let's look at the genetics that can actually drive any of those things. And then we dig through, what types of environments have you lived in? What was your emotional environment when you were small and throughout your life? And, when did you have medicines for the first time? When did you have antibiotics, or were you vaccinated? Were you not vaccinated? And were there traumas? Were there accidents? Were there, what sports did you play? Did you live in a different country? Did you spend a chunk of time maybe living in a really polluted city? Did you live in a house that had mold in it? Did you have glandular fever when you were a teenager, or maybe you were traveling in Africa and got malaria? Like past infections can have the capacity to trigger things that then go dormant for a while, but are having an underlying manifestation. And, generally we always come back to the gut, because the more and more we look at it, there's more research coming out every day. Even, like last year, there was heaps of research that came out around the link between Parkinson's and gut health. So I dig through the whole lot, and it's really interesting because people are like, wow, I didn't know there was so much to know about me or so much that mattered.
Well, that's okay. So you're rattling off all these awesome, like these places to investigate, and I can feel like I often get excited when I think about like just how much there is to dig deep, and especially when you thought like what was the environment for when you're in utero. What was the, even like looking at what was the preconception kind of vibes, what was happening when you were an embryo and you were unfolding. Like, I don't know whether like when you get, because there's a difference. I know like a lot of people can get told that and be like, oh my gosh, this is so much work. And then, like obviously then we go back towards being dependent on a medical system or an institution, which is a fine choice. But when you can just have a smile on your face and go like, all right, just let's go get some clues, just so like I can, just so that like at the front of my mind as I'm going through and trying to figure out what the source of this thing is, I can get it like and just have a little bit of data there, or I can just have a little bit of insight. Just knowing, just remembering, as you said, like when was the first time you had medication? What was that medication? What were the vaccines? What were the combination of vaccines that you had? What was, like what animals were around you when you were a child? I'm sure like all these things, like I'm getting excited. You're kind of reminding me to start just considering those things more and more, because like you started in the embryo, and as we unfold, brain and gut are connected, and we just keep on unfolding within a pattern, right? And so it makes sense. We're going to have to go back and see when we've put little stakes into that unfolding. Yeah. Okay, and so from there, what do you find, like, I know this is going to be a general question, what are you hoping to find that will take you to the source of what's causing neurodegeneration in the first place? Okay, so I want to have a look at the genetics. So I'm sort of asking those questions to go, how deep do I need to dig into genetics? Do I want to look at really their gut health and say, anything that, because we know that if you give a child under the age of 3 antibiotics, you may as well have dropped an atomic bomb on their gut as far as their microbiome. It's then very hard to recover. So
is the gut going to be, the major thing, the major place for us to start? Is it potentially a toxic load, some sort of environmental thing that has been a really big thing? Has there been a big infection? And one of the big things that I've probably learnt more about in the last 8 months is I always ask the question, have you ever had, like a major concussion or a whiplash injury or a blow to the head? And it's interesting because we now understand that there can be slight shifts in the cervical spine that can actually change the way the brain detoxes. And that, when I start asking people those questions, they can be in their 50s and they're like, oh, yeah, like when I was 4, I fell out of a bunk bed and woke up in hospital 5 days later, and that's like, hang on, that's pretty profound, and that's going to have had a big impact very early on. Or it might be, I was a gymnast and I had heaps of, obviously I had lots of falls and things like that. Or more recently, I had, a young girl who in the last 3 years has had 2 major car accidents with huge whiplash injuries. Sometimes it can take 3 or 4 sessions for people to even remember that, 5 or 10 or 25 years ago they had this particular accident, but it might be what we need to, it might be the key. Because people always say to me, Jo, what's too trivial to share with you? And I'm like, until you tell me, I don't know, because it actually might be that one, the last key that we're looking for. Do you know what I mean?
Absolutely. It must be cool. Like I can just kind of like imagine those sessions. I know you leave like 2 hours for those intro sessions. I can imagine you enter into that vortex, and it'd just be one of those places where you've set up the space, and within that vortex that information will rise up. Do you find that, or like it's like, cause I think about one of those things when like, oh, I'll just forget, but being provided, like I think I would have forgotten, like maybe I won't remember it and it just won't come up. But when the space is provided, it's like a vacuum for that information. Do you find like it's always there, like it always comes out?
Yeah, it doesn't always come out in the 2 hours. I used to do 3 hours up front, and then it would always come out. But that's a bit daunting for people. So it's a bit like peeling the onion. And there is, literally, like I said, I've seen it take 3 sessions with someone. So we have the big one, and then one day they'll just go, oh, I forgot to tell you about this accident where I fell down the stairs and I landed on a concrete tile, and I woke up in intensive care. I'm like, yeah, that might matter. Can we have a chat about that? Yeah. So it's just providing that safe space, and then it's kind of starting to unlock pieces for them. So although it may not come out in that first 2 hours, all of a sudden I get an email going, oh, Jo, I just remembered this, and it's like awesome, because that actually gives me somewhere else to look if we don't find the answers here.
Yeah, cool. And look, I just want to quickly touch on you said the brain detoxification channel, or like I'm not sure whether you said channel, but the brain detoxifying, I'm fascinated by that. Just in case we don't get a chance to come around and talk about it again, can you just mention that pathway and that mechanism?
Yeah, it's something that I'm still getting my head around, because I did some training with a professor last year. I don't know if you've heard of Dr. Daniel Amen.
Of course. Like I've seen him talk in LA 2.5 years ago. It was amazing.
Yeah, so I actually spent some time with the professor that runs his New York office in June last year after the functional medicine conference, and he's like, oh, Jo, have you ever heard of craniocervical syndrome? It's like, yeah, no. So he showed me through a case of a patient who had come to them. He'd been told by his GP that he had dementia. He was about 70, and he's going, there's no way in hell I've got dementia. You're full of it. That's not the case. So he went to them, and they did the SPECT scanning, and basically they did an upright MRI, which is actually quite challenging to get. There's not many of them in Australia. But what they found is he had a slight shift in his atlas and axis, so his C1, C2. And it was enough that it wasn't changing his function as in his physical function, but what it was doing was it was making the cerebrospinal fluid actually pull in the back of his head in his brain, so it couldn't process down around the spine, which is where more of so it's where the body then allows the toxins to go out into the lymphatic system. So he had basically, I think, about 7 months of this very specific type of chiropractic treatment, of which there's only 2 chiros in Sydney who are qualified to do it. And slowly but surely they shifted those 2 vertebrae to bring them back into line. And by the time that he'd finished his treatment, his brain was back functioning the way that it had before he had any symptoms of dementia whatsoever.
Far out.
So that was done with the atlas orthogonal treatment, with hyperbaric, with nutrition. supporting everything, but basically it's like, well, hey, there are so many possibilities, you know, and it was only the fact that this guy turned around and went, there is no way that I have dementia. And, you know, I think he'd been a CEO or something. He was used to controlling things. And it was great because he went digging for it. So, you know, it's the more of these people I learn, I don't necessarily always get to learn in massive depth, but I then have all of these, I have my brain's trust of people that I can reach out to and ask things about, because it's like, and what if it's that for that person?
Yeah, gotcha. Okay, so when you're going in and so you're assessing what's going on within a person's brain and you're looking at the source, which I feel like everyone can do. You don't have to be clinical. Like, you can just go and have a look back at your past, and then from there, what are you finding are the main, like, so we've covered the main sources of what are going to be causing neurodegeneration.
Sorry to interrupt, Mason. There's probably one other one that I haven't sort of specifically spoken about.
Yeah.
And that's mitochondrial dysfunction. So we know that the mitochondria are basically, all your cells have lots of them. They're kind of like the little generators, and actually if you look at them, they're very cool. They look like a little generator. And your heart cells and then your brain neurons. So your heart cells have about 5,000 mitochondria per cell, and your brain has about 800 per cell. Yet your brain uses a whole lot more energy than your heart does. So we're finding that there are more and more things in our environment that are damaging our mitochondria. And that's where, so you see lots of fatigue, and fatigue's probably the biggest thing that you see with mitochondrial dysfunction.
Yes.
But it is a huge player in this space.
Yeah, right. Yes. Well, let's go into that. Let's if you're feeling it, we'll start with the mitochondria. Otherwise, the gut. Wherever you're feeling to dive in into what we're doing, both in treatment and prevention, and how we're going to get on top of this.
Yeah. So I think we'll probably start with the gut, because, you know, your gut's always the first one to get angry, given the fact that you put things in your mouth, it comes out the other end, and it touches your gut all the way through. Which always makes me laugh when there are certain specialists out there who should know better, and they just say, yeah, it doesn't matter what you eat. Funny that. So I think, you know, our gut does leave us wide open to risk. So, you know, massive percentage of our immune system is based in our gut, because it's our body trying to protect us. You know, it's where we have our good bacteria, it's where we have our bad bacteria. Our good bacteria help us to actually digest our food and turn it into nutrients and components, chemical components that our body can actually then absorb and use. And, you know, we have genetics that will come into play there as to how much we need, as far as whether that be detoxifying or cleaning up or, you know, producing chemistry. I'm trying to think about how to make this simple. Sorry, that's not always my strongest point. But we do, you know, like, food really matters. Yeah. And, you know, the right food for each of us really matters. And, you know, appropriate fiber and looking at probiotics, the quality of everything matters. You know, it's not, you know, something that you buy off a shelf that's, you know, $10 versus, you know, if there's a comparative product that's got heaps of research on it for $80, there's a reason that you're paying a difference, you know. But also our diet now, you know, like, our diet is full of food-like products. So it takes a really conscious effort for people to eat seasonally and eat fresh food, and where possible, eat chemical-free or organic. And anything, because everything that touches our gut is going to affect our general health. And then obviously that drives our brain health.
Yes.
So, and it also drives our mitochondrial health. So things like infection. So glandular fever is a shocker for setting us up for issues with mitochondrial health down the track. But, you know, so are toxins. So is living in a moldy house. You know, I had a chronic fatigue patient who was 48. He's suffered with chronic fatigue on and off since he was 15. And when I dug into, you know, had he ever lived in mold, he goes, oh, yeah, I grew up in New Zealand on a farm on the lee side of a hill, so the house just never dried out. And he was going, oh, my God, okay, so now we need to go back and start there. You know, so it's mitochondria. I think whether, you know, if your adrenals aren't happy, down the track, your mitochondria aren't going to be happy.
That's what I was like. I've always made that connection between, like, the adrenals and kidneys being where, like, the storehouse of the baseline energy of the body is kept, and this, likewise, the mitochondria are like those little kidneys of the cells holding that Jing energy. Yeah,
and that, you know, I love looking at Chinese medicine because it was all learnt through observation. So it was very different to Western medicine, which came down to, let's just chop everything up and then figure out, you know, what's where, and if you can't see it, it mustn't be there. So to me, the beauty, the art of healing is actually very much bringing together the two and looking at all of those components.
Agreed.
So, there's lots of things in our world that are toxic to our cells and to our mitochondria. Things like, you think in the 70s and 80s, the main thing that we were using for oils were rancid seed oils.
Yeah.
And we just sit there
pretty much a lot like that's like.
God, what were we doing?
So prominent still, though. It's like still those big bottles of
cells, every cell has a lipid bilayer around it, and that's made up from omega-3, arachidonic acid, EPA, DHA, phospholipids, and they all get displaced when you're having really crappy fats in your diet. They end up being displaced by the wrong ones, and then it damages the transport. You can't get nutrients in and out. You can't get nutrients in. You can't get waste out. So that affects all your mitochondria.
All of a sudden, the membrane becomes a GMO canola field rather than a nice, like a nice marine, essential, fatty, saturated space that's actually conductive and can open and close with ease and communicate with the rest of the body.
Yeah, same as like all the myelin on all of your nerves. So, our nerves act by literally, it's like the action bounces from myelin to myelin to myelin to myelin along the nerve sheath. That's where things start to go wrong with multiple sclerosis. And if you've got the wrong fats in your diet or too low of fat in your diet, and then you end up with, a condition like that, then it's actually damaging those. It's about having those good fats. And what are your favorite fats? How do you get them into your diet? Yeah, my favorites, coconut oil, avocado, macadamias, and oily fish. Yeah. A little bit on flax, but I'm a little bit wary. And my passion is hemp. So basically because in the ideal world, our omega-6 to omega-3 ratio would be 4:1. In the Western diet, it's more like 20 or more to 1. But hemp seed oil is actually 3.8 to 1. So it's as close as you're ever going to get to the ratio that should be lining every single one of our cells. So companion food for humanity, right? Yeah, totally. Yeah, I love it. And so, I'm just interested, like, when you're, like, looking at the cell health, because, again, it's getting a lot of attention now, which is amazing, in the health scene anyway, and I hope that a lot of people listening to this, like, if it's the first time you're hearing about your mitochondria and your membranes and your cell metabolism and health, get amongst it. It's a very fun topic. So I'm just, like, so we've got the fats. So you've talked about the DHA and the EPA, and you're getting the ALA as well from the hemp and a number of places. Likewise, I'm a little dubious when it comes to flax. I like using them in my colon cleansers when I do them, but much more inclined to go for like a chia or something like that to get my ALA content. And I feel that's always worth mentioning. Omega-3s get thrown around a lot. There are, especially those essentials, DHA, EPA, and ALA, people will say, hemp and chia, they have all, and flax, it has all the omega-3s and that's all you need. But it's always worth mentioning that the DHA and EPA are marine-based fatty acids. So I just wanted to throw that out there. It's because it's one also, I think, sorry to interrupt. Go for it. What a lot of people don't realise is that, the EPA and DHA is the form that your body's going to use. So if you're using a vegetable source, and I'm not saying they're not good, but it means that you have to have, really efficient fatty acid metabolism to be able to convert those fats to the active version of omega-3. Yeah. And probably the one other fat that I forgot to mention is I'm a really big fan of good, clean, organic, extra virgin olive oil, particularly in people with cholesterol issues. The biggest challenge is trying to find good quality. Yeah, there's not many people. I mean, there's like a stone roller kind of like guy, German guy that brought the technique over, and he's in Victoria. But yeah, like I think that's even a nice distinction for people to be like, going for those kinds of qualities. Just think about something that's going to hold itself. That's not going to turn rancid, and and of course, like as like a small batch as possible, because most of the time when all these things go rancid and becomes not so great for our health, it's through large production and transportation that didn't really go down the way that they were hoping. And so, just like small and local as possible, but just baby steps into it if you're starting out. Any other little things that you like doing for your mitochondria to like
get in there, and as so many people are talking about, cell hack your way to super health?
Yeah, I can't say I love it as in I like doing it, but I do it because it's really good for me, and that's cold showers.
Oh, cool.
Yeah, so I think, really cold showers is really important.
Yeah, I'm really happy you brought that up. Like, that cold plunging is, it's magic. Are you there jumping into the ocean in Manly in winter? If not, you're going to have to do it this winter.
Yeah, it's one of those things that's such a mental game because I hate the cold. And, there's a reason I don't live in Melbourne anymore. But yeah, I do that because it's really good for me. People really underestimate sleep. Given my own health history, sleep is one of my, as far as I'm concerned, it is the greatest free medicine on the planet. And, sleep quality is crucial, and it's probably one of the biggest players that I see in patients who, whether we're talking brain health or mental health, there's 9 times out of 10, they're either getting not nearly enough sleep, really poor quality sleep, or their sleep is just absolutely rotten. So that and exercise, and meditation, they're probably my key pieces. They did some really cool studies, one that was published last year around, have you ever heard of BDNF? So it's BDNF is brain-derived neurotropic factor. It's a thing that actually helps you grow new brain cells. The lion's mane.
Yeah, okay, so the nerve growth factor. Yeah, right.
So they did some studies to see what type of exercise and what durations of exercise improved BDNF level. And, there's been so much attention given to HIIT and CrossFit and, short interval and that kind of stuff recently. Yeah. And, they compared moderate cardio of 45 to 60 minutes, 5 days a week, to HIIT training, 15 to 20 minutes, to weight training. And I think we do need a combination of all of those. However, from a brain functionality and a brain health improvement process, you do actually need 45 to 60 minutes of moderate cardio a week, like 5 days a week. Yeah, right. So it's sort of looking at that and going, well, how do I put that into my space? So that was a real eye-opener for me because I'm an ex-endurance I'll call myself a weekend warrior. I don't know that you could ever call me an athlete. But I've always, exercise has been a huge part of my world since I was like sort of 15. But really interesting when you look at the research now that they're saying, right, we can actually see what's affecting the things that help our brain grow or the things that help our brain repair. So these are all things that help to play into that space.
Yeah, wonderful. Okay, so we're talking about this is both in treatment, we're talking about all these factors being the absolute bread and butter, just to, I know we are talking bread, possibly a gluten-free bread or a local heirloom seed, and grass-fed butter. Yeah, so we're talking about the bread and butter, basically, of therapeutic treatment, and at the same time, you want to prevent the onset of premature aging of the brain. These are those staples. Magic. Having a lifestyle. The thing I like about that is it's a lifestyle that doesn't just then revolve around brain health, because there is such an integrated approach here. Because quite often, if you're specializing in something, it's like, right, life is going to revolve around this thing that happens to be the brain that I'm specializing in. Whereas what you're talking about is just supporting basically every organ function, and so on and so forth, and all those systems. And of course, you've gone and studied the immune system and how that interplays with the brain as well. What was that called again?
Psychoneuroimmunology.
Okay, that's right. Now, I'm just fascinated there in terms of immunity. What do you do for immunity? And is there, what's going on with the immune system inside of the brain, or is it, guarding the brain? How's, don't need to go too deep, but how's that working?
So I think the thing is, Mason, I think I try to not segregate things out too much. We can't just work on the brain's immunity as such. And, so to me, if anything that I'm trying to facilitate through the brain, the gut is going to be first port, then removing toxins is going to be the next port, and really managing stress. We just don't, I don't think there's, people bandy around the term stress all the time, but then it's like, oh, you just meditate for stress, or, it's really not, the systemic impact of it, I think, is really underrated. So, if you're incredibly stressed, that's going to flatten your immune system, but it's also going to make your hormones go. If we're this stressed, we don't really need hormones because, you know, we can't be reproducing, we can't be doing all of the things that we need to do, and the body will actually, or the brain actually will say, okay, I actually need to reroute those hormones to the stress hormones because we need more of these stress hormones. So, you know, we don't need to do the other stuff. So from an immune perspective, it's really looking at overall, we impact, to me, we need to look at absolutely overall health to impact the immune system or the endocrine system, so all your hormones, you know, your energetic system, your detoxification. If we're working on all of it, like there are different things like functional foods. So, you know, the chaga that you guys do, I think is amazing for immunity. Rest is really underrated. If someone's actually sick, you know, how much, the number of people that I get, they're like, oh yeah, I sleep 3 or 4 hours a night. And it's like, yeah, but what do you do to relax? I watch TV. Awesome. More blue light. Fantastic. You're giving your brain, you know, even more of what it needs. Thanks. Maybe turn your lights off, get some orange safety glasses and use candles instead of halogens or fluoros or things that are just going to give you more light and trigger things off more.
So guys, I'll just kind of touch there, just in case you're not familiar with the blue light phenomena in lights within our house coming off our screen. That blue light, it's like first thing in the morning, the sun is really nice and bright because it's got that blue light and it's like adrenalizing and it tells your body it's time to get up and wake. And then in the afternoon, you watch it, it kind of becomes more of a red and golden light because the blue begins to disappear because that blue is not appropriate to be hitting our eyes and telling our endocrine system, adrenalize, time to wake up. You know, it's like cortisol, adrenaline. And in the Western world, these lights and screens that we're looking at up until we're in bed have got that blue light, and it just completely throws the nervous system and the endocrine system. And so they're orange blockers, orange glasses, the blue blockers. For those of you that are on video, I've actually got an old pair sitting here. They make you look like a construction worker. And for those of you that are on audio, you can go check out Earthing Oz, or have you got any recommendations for places to get that kind of stuff?
I think Optimize do it. You can, you know, for things like your phone, your iPad, your screens, there's a really cool app called Flux, which you can actually, you tell it where you are in the world and what time you go to bed, and it actually starts drawing all the blue light out of screens. But obviously you can't do that for TV. But I think what I always say to my patients is, because they're like, oh, do I really have to turn it off? And it's like, yeah, because when you look at that blue light, it's telling your brain that it's daytime and it stops making melatonin. And melatonin is what you need to be able to go to sleep. And that's only there for like 30 minutes and then it's gone. So it's like when you push through that tide, I need to go to sleep, and then you wonder why you get wired again. It's because your body's just disintegrated that melatonin and gone, right, apparently we're not sleeping now.
You know what? One thing I think happens as well with that, and I'm just kind of like, it's kind of theory about it. It's just another thing that's doing like hitting the pleasure center, because there is a lot of serotonin in the morning. It's a time to be like, and get up, and so it's like we feel good. But I feel like those, like that lights on moment is like, it's addictive and hitting that dopamine receptor as well.
Yeah.
I just kind of thought about it, because there's another element of where it's just going to be like bleeding the brain and the gut dry of that neurotransmitter dopamine. Another thing is like, and at the same time, it's at night picking up the screen, or, you know, and hitting notifications on your Facebook, and boom, hit that dopamine receptor again, you know, get that pleasure, and like, and then like, and then next you like put on the TV and it's like big exciting ads come on that are there to make you get excited and remember your childhood, and the dopamine receptor gets hit again, and you know, so on and so forth, you know. So I just like, there's just so many elements there, and it gets complicated in a sense if you think about all of them, and do I have to do that, and do I have to do this? But I agree with you, it's just something to be aware of, and just start to weaving into the lifestyle that consideration. Get Flux on the computer, possibly just light a couple of candles, maybe just don't use your phone at bed, maybe turn the TV off and chat, read books. It's so much sweeter anyway. But at the same time, I get it that for a lot of people it can be a big transition. So just like, you know, have fun while doing it. I'd love to just talk, unless it's like, feel free to jump on anything I just said, but then I'd love to just hear about your take and use of hyperbaric and the role that oxygen plays in the brain and body's optimization.
Yeah, awesome. So, I mean, as you know, I just opened the first one on the north side of Sydney, and that was because I fell in love with hyperbaric about 8 months ago, the second last trip that I did to the US. And, I'd always thought of hyperbaric as being, it's for diving and it helps sports people with recovery, but had zero concept of what it did for the brain. And when you think about, so many of us spend our time in that stress response place. When we're doing that, we're chest breathing, we're not belly breathing. So we're really not getting oxygenated the way we need to. And then when we're toxic and we're surrounded by these, whether it be emotional toxicity or environmental toxicity, then our body goes into oxidative stress. So we use up oxygen even more. So the theory behind mild hyperbaric therapy is the fact that you increase the pressure slightly. It doesn't need to be increased to the level of, the big hyperbaric hospitals for burns units and things. It increases the uptake, the blood's ability to absorb about 30% more oxygen and deliver that around the body. So it actually helps grow new brain cells. It helps grow new blood vessels. It helps, rebuild connective tissue. It reduces inflammation. So it helps with pain syndromes. But, we look at, again, Dr. Daniel Lehman's clinic is where I learnt a whole lot more about this, where they predominantly deal with neurological and psychiatric issues. And a lot of the stuff that they're working on too is with traumatic brain injury, concussion, and, in America, the NRL. So, sorry, NFL.
Yeah, NFL, NRL here, right? Yeah.
NRL here, yes. So I don't know if you saw the movie Concussion with Will Smith, which was talking about, the issues of the American football players who many of them were ending up with, Alzheimer's in their late 40s and psychosis and all of these different brain conditions. And what they found was that the brain damage happening from, a helmet actually stops your skull from being cracked, but it doesn't stop your brain from bouncing around inside your skull, which is not a very brain-friendly place, to be totally honest. So then I start talking to them about, what have you guys seen with Parkinson's, with Huntington's, and they do some really cool scanning called SPECT scanning, that we can't get here. And with 40 hours in 30 days, you can see a brain that has all of these massive dents and things, places where blood flow is not going and, there's no activity, to a healthy brain, or dramatically improved brain function and capacity in such, in a short period of time. And it's, when you consider it's completely safe, you just get to lay there and meditate or read a book or sleep or listen to your music or whatever. And it's oxygen is actually supporting your body to triple the rate of healing and to fix things that you didn't even really know were there. So, whether we use it for chronic fatigue, I'm seeing great results with Parkinson's. I've got patients with Lyme and mold going through, patients with severe arthritis, one lady who travels, an hour and a half across Sydney in each direction because she's trying to not have to have a knee replacement. And she's just like, I can't get over how much better I feel in a short period of time. So, when you look at it from a brain perspective, it's people are getting better quality sleep. They're less anxious. They can think more clearly. Their brain fog's, slowly but surely dissipating. And it's like, damn, why wouldn't you do it? And I said the exact question to the professor that runs the New York office for Daniel. And I'm like, Sandy, who would you not use it with? Like, who would not get benefit? And he's like, there's no one who walks in the door who wouldn't, and even to the point that they have done some amazing studies on kids with cerebral palsy. Now, we know that cerebral palsy, they don't have cerebral palsy in utero. It happens because there's an event in the process of birth that blocks oxygen to the brain and does damage. So they did some really cool studies of these kids at sort of low-level, no hyperbaric, low-level hyperbaric, and then the really heavy-duty stuff. And they basically found that the improvement was equivalent no matter what level of hyperbaric they had. But it was profound in the amount of, functionality that they got back, and improvement in their cognitive function as well as their physiological function just by being in hyperbaric therapy. So I'm a little bit passionate about that. Yeah,
and rightfully so. I mean, even like in, I won't go down this river, but like even post-traumatic stress syndrome, I've seen just even the results there, and I can imagine that is always going to have, there's going to be a reflection that's not necessarily is going to be all in the head. There's actually going to be stuff going on in the brain at the same time. So just want to talk about viral load. I mean, I know, like, we were talking about like medicinal mushrooms before. I just want to hear your 2 cents on whether there is any viral bacterial implication to brain degeneration or just like a brain function.
Yeah, massive. So one of the types of Alzheimer's that Dale talks about is actually called viral, which is viral and infectious. Mm-hmm. You've only got to look at things like Lyme. Lyme disease causes the most horrific brain symptoms for people. If we forget the rest of the body and just think about how it affects, massive brain fog, lack of concentration, no memory, can't read books anymore. It's when that Lyme spirochete gets neurological, far out. It's like literally spiraled in right into those neural cells and gets into the brain. It's why we like. I mean, we constantly tell everyone here, when if you get bit and those symptoms start to come on. I mean, I experienced it just before I was born. It was like there's a lot of herbs you can hit, and even my top mentors who write the herbal protocols, who educate about what antibiotics do to the body, are like, if it's seeding, there are antibiotics. This is one of the times. Yeah, It's you've got to. There are times when Western medicine have done amazing things for us, and everything has its place. It's nothing. Look, I'm not a fan of chemotherapy, but other than that, antibiotics and things, absolutely they have their place. Mm-hmm. There's no doubt about it. Lyme is one of those. I think the other one that I really see being problematic for the brain is mold, and I hadn't heard much about mold illness and chronic inflammatory response syndrome until I did that training with Dale. And there's been a lot more work that I've done and study that I've done and people I've connected with over the last 2 years, looking at the impact of water damaged buildings on brain function and, overall physiology. And most of the presentations are neurological. So whether they be mental health presentation or, just there's 37 different symptoms if you have mold exposure. And that's because of the way that it gets into your brain pretty much through your nasal passages and your sinuses. But then once it's there, it affects everything. So, we've really got to be vigilant about this stuff and not just think, hey, I feel better, so I must be better. Let's rebuild your whole system. Make sure that, you've got the nutritional biochemistry levels that you need. We see it, zinc levels are generally really low in people with neurodegeneration. B12 levels are often really low. Methylation doesn't work well, so you need more of your brassicas. You need folate, not folic acid. You need to look at your magnesium levels. Magnesium is crucial for the brain, but the main one that gets through the blood-brain barrier is magnesium 3 and 8. We don't even have that here. So there's lots of different things that we need to look at and consider that can be helpful.
Okay, cool. Well, there were a couple of awesome ones that people can take away. I mean, like zinc, B12, like methylator there, like zinc getting into the kidneys. So we're kind of getting that link there. Any other supplements? And I'd like to hear your take on the lion's mane as well, because I know you use that clinically.
Yeah, so I love lion's mane. It's become one of my favourites, and I talk about it to my brain patients all the time. I use it every day, but I'm also super stoked about this new little combo that you guys have got coming out. So, look, lion's mane, what I've noticed for me personally, I use it twice a day, and it really, my level of clarity, concentration, focus, and, memory are much better when I'm taking it. But, I'll give you some examples of patients that I've used it with. So, I recently had a young guy, 16, about to start year 12 with glandular fever. And, glandular fever, one of the big things that happens is brain fog and you can't read books and stuff. He swears by the stuff, and he's just walked into year 12 going, Jo, it's funny, for someone who spent the whole summer so sick, I'm performing better in all of my classes, and I put it down to the lion's mane, And then a patient who she's about 50 and she's very Vata in her, so the Ayurvedic dosha, very Vata in her constitution, and so very out there in ether, and struggles a lot with anxiety, and it's giving her the lion's mane has really given her the ability to ground and concentrate and focus.
Oh, cool.
And then I've got women in their 50s and 60s who use it in the afternoon instead of a coffee with turmeric and coconut oil and cacao, and so it's really anti-inflammatory. But they're just like it switches my brain on.
So good.
I love it. I absolutely love it.
I really love it as well. It's a really special herb. And I know that with the students, like, it's so funny. A couple of years ago when we were like having some growing pains and we couldn't quite keep up with demand of lion's mane at the time. We'd run out, and we made the mistake of running out before uni exams one year, and they were like pissed. They were called like these students, and I thought it was like, they're like, no, like, I'm not going into this exam without lion's mane. You seriously need to get it to me ASAP. And we were like, oh, okay, no, you're serious. And like, and again, it's just nice to, it's one of those beautiful herbs that it's just like, it indicates, the research shows that, it's going in there and acting as a prebiotic for the bacterium, helping plump up the bacterium. They use it for ulcers, but then it's one of those tonics that people can go, oh yeah, on the other side of it, it's not just therapeutic, it's going in and plumping up and, strengthening that, the wall lining, and those bacteria, so that these things like ulcers don't come in the first place. Likewise, up in the brain and through the nervous system. It's like, it's not just for when there's fog, or, just when you have to have, like, when you want to focus. It's like, it's one of these things, just like everything else you've been talking about that's lifestyle based. It's like, well, we take this now so we don't have any fog when we're like 90. Like, there's like that kind of level of tonifying. And I really think Hyperbaric's one of those as well for the Western world. I'm completely on board with you. I mean, it's used therapeutically, of course, but it's one of those things that, like, I'm almost just waiting to like manifest one, that I can get in my own home. I know I spoke to you about wanting to get one in my, my mum's home when we talked last week, and I think it's like the same with like lion's mane, same with diet, same with omega-3s and fats. It's just one of these things that can come and be a part of your, your living and breathing culture, your family culture, so that we can just have like, well, first, because we've got to acknowledge. Always got to acknowledge this Western environment that we're living in, and there is, like all that mold present, everything that you've been talking about. It's in the beginning. I know I found it quite confronting when I was looking at the amount of heavy metals and so on and so forth, and viruses that are around the world. But it becomes really sweet when you get on the front foot and stop focusing on all those issues and problems, and look at what you're kind of weaving and creating for yourself in the future as well. That's what I really like about your work, Jo, and your clinic, and the fact that you're down there. I mean, the last, maybe you did it Ruby Lane, where you did your talk in Manly. The fact that you're doing these community talks and having conversations around prevention. I love that. I love that approach, as well as operating clinically, because I think one of the things that happens, for me, when I've been talking to clinicians and therapists, is they don't have that skill to have a conversation with someone, and yes, being a patient and clinician, but at the same time be able to remind them that they're not always a patient, and to get them out of that mentality at the same time. Like, I think that's a real skill. I was just chatting to a friend about it yesterday, how much I admire folks that are able to do that, and I really feel you do that, and I really feel it's awesome that you're out there doing that educational work for the folks in Sydney. And I mean, we will have a lot of people listening to this from the northern beaches there, because that's where I kind of started out. Like, Superfeast really got off the ground, is up at French's Forest Markets, where and so hopefully a lot of people will be able to come and check you out. Well, we won't finish up just yet, but I do want to just let everyone know that Bounce Matters, so BOUNCE, Bounce Matters, matters.com.au is Jo's website. And the fact that you got Hyperbaric there on the northern, up in the north of Sydney there is amazing. And for people all around the world, go and get onto Hyperbaric especially. But you can check out your, you've just got lots of awesome stuff on that website there. So, I mean,
thanks, mate.
No problem. Like, I really like it, and I really mean it. I always do, of course. Why wouldn't I mean it?
So can I just actually share with you guys what Bounce Matters is about?
Yeah.
Because people always say to me, they're like, "The hell is that for a name for a health clinic?" And
I'm
like,
cool.
Do you actually bounce out of bed? Or do you hit the snooze button like 1, 2, 3, 4 times? Because remember when you were 3 and it was like you woke up and was like, yay, what am I going to do today? Life's so awesome. And now we're like, oh my God, really? We have to get out of bed. And so to me, it's like, if you're not bouncing out of bed, and look, we don't do it, nobody does it every day. But if you're not bouncing out of bed the majority of the time, to me, your brain and or your body are not firing on all cylinders. And it should be, because you can't live like the best life that you possibly want if you feel like rubbish.
Yeah.
So to me, that's what the bounce part is about. It's let's just live life to the full. And to me, you need optimal whole health to be able to do that.
I love it. And I've just gone like scrolled down your website there, and there's a picture of a woman that's just like face planted at her desk with coffee, there's chocolate, there's a couple of cans. And it's just I consider this really hard hitting little quote that I imagine she's saying, but I'm sure she's a model. But anyway, I never feel this way, but it's been a year now. And I reckon that's something that needs to stay in the conversation, especially I've noticed in at times with myself, and whether it's kids in their 20s, it's like 30s, 40s, all the time. It's like all of a sudden something shifts and changes, and it's just like, that's all right. Like, in a sense, it's like, oh, I will bounce back, and then it gets to like a year, like, this isn't me, this isn't normal, it's like, and then it's been a year, and it's like really, like, I just want, like, at that point, it's like, then you got to jump onto it at that point. You need to start getting in and digging at that point, because there's probably something going on within the body and the brain.
Yeah.
Okay.
Yeah, totally.
Well,
it's, I just think we need to, and the reason I do the community events is because I'm trying to do a lot more this year. It's sort of,
good.
Just trying to make it fit, but because I want people to be able to have stuff they can take home and do it. They literally walk out and go, oh, well, we can change this and we can change that. And, like, we can buy a toothpaste that's fluoride free, and, we can get that list of the dirty dozen and the clean 15, and we can't afford organic all the time, but we can do these ones organic, and, we can use less toxins in the cleaning stuff that we use at home or our personal care things. And, we can eat more seasonally. We can go to the farmer's market on the weekend.
Yep.
And, we need to make more effort to, some people you tell them to meditate and seriously they just want to slap you over the head. But if you say to them, hey, why don't you go to, especially on the beaches, go to the beach, take your shoes off and go and squish your feet in the sand, and reconnect with the planet. There's so many simple things that you can do every day. Go to bed half an hour earlier, just little things that, are going to save you and give you years back on your life and, amazing quality back on your life.
I love it. Jo, thanks so much and coming and sharing in this, on our podcast, in this series. It's going out to everyone. Everyone's like jumping on board, upgrading their brain and, getting on the herbs, and thankfully also going to be getting onto all these practices as well and just getting that full spectrum lifestyle vibe.
Thank you so much for having me. I've really enjoyed it.
Yeah, me too. All right, awesome. Well, hey, we have to hang out in Sydney. I'm going to really make an effort. Yeah, I think I'm down soon, so I'll get in touch. We'll
awesome, please do.
Charge a wave. See ya.
Okay, see ya. Have a good day.
You too.